There was one time where I actually had a medical doctor come in as a patient, and she was an ER physician. When we sat down and we were talking about degeneration, I said to her, I got to ask you a question because this is really confusing me. All my patients that are coming in that have degeneration, they said that their doctor told them that their degeneration was from aging. And she said, yeah, that's what we tell them. And I said, so you tell them that it's just from aging, that the reason why they have arthritis or degeneration is from aging? She said, yes. She was confused why I kept asking her the same question over and over again. And so I said, let me ask you a question. I said, have you ever had patients come into the ER and they have an issue with their knee, and that's why they're coming in? Maybe they tore something in their knee or they have severe pain in their knee. She says, yes, quite often. And I said, and when you do an x-ray, you do an x-ray of both knees, right? She said, yeah, as a comparison. And I said, do you ever notice that one knee is more degenerated than the other knee usually? She goes, yeah, almost always. The two knees are usually never look the same. And I said, well, if degeneration is from aging, how much older is the bad knee than the good knee? And she was just like a deer in headlights. And she was just like, actually, I never really thought of it like that. Wait, so where do you think the degeneration is coming from? And that's when we started discussing the idea that degeneration, especially when it's accelerated or when it's significantly more in one joint than the one above it or below it, or in one knee compared to the other, that is from abnormal biomechanical stress or abnormal stress on the tissues of the joint that is causing an acceleration of the wear and tear. Normal tissues should heal normally for a long period of time. And maybe when you're in your 70s, 80s, 90s, we start to see a breakdown of those tissues and diffuse degeneration throughout many tissues of the body. But when we're seeing it significantly more in one area of the body than another area in a 32-year-old, that is certainly not normal. So where does it come from? Where does degeneration come from?